In New York, it was absolute chaos for several months. There was no sense of anything but death. Our nursing students who volunteered to go into the hospital, these are young nursing students, right? It was volunteer because we would not mandate them going in at that moment. They would sometimes on a night shift see 6, 7, 8, 10 people die. And there was no way even to be with them, which is such a part of an essence, right, of our nursing and medical profession, is to be with people and to acknowledge them and to give them dignity. Now, we could have learned very early from you what was needed to respond to COVID-19. You were the pioneers, and you were showing effective ways to contain it, to protect healthcare workers, and to seek recovery. China had the knowledge base, and it was ignored in many parts of the world, consciously ignored. The previous government, under their direction, a vicious campaign, nothing new in the United States, but I will say this, of anti-Asian campaign was leashed and continues. It's not the first time that there's been great racial discrimination against people of Asian descent. It's certainly growing under many, in many communities, this fierce xenophobia. Many things were happening and were let to happen. The importance of solidarity is to acknowledge that you had lessons we could have used, right? And we weren't given that ability to have you guide us. It's so important to say that's why we need global, because we need to be able to share that. We needed to learn from you, and it was not permitted. It was ignored. It was misinformation.